Hello everyone, my name is Shonushka Sawant, and I'm here with my colleague Harrison. Today we'll be giving a talk on how measles vaccination rates and case rates have changed in recent years. The United States is currently in the midst of a measles outbreak, which began this January in an under-vaccinated religious community in Gaines County, Texas. In the 5 months since, over 1,000 confirmed cases have been reported in 32 states, as well as Mexico and Canada. Measles was previously declared eliminated in the United States in 2000, but it has resurged multiple times since then, largely due to falling vaccination rates. According to the CDC, a population with 95% MMR coverage can be considered to have herd immunity to measles. The United States no longer meets this threshold, so let's take a look at how vaccination rates have changed over time. This plot displays median MMR coverage across U.S. states from 2009 to 2023. Here, we note that median MMR coverage fluctuated between 94 and 95% until about 2019. After that, we see a sharp drop starting in 2020, which corresponds to the beginning of the COVID-19 pandemic. Here, we have a map displaying statewide MMR coverage in 2009. It's color-coded, so we have states with 95% coverage or higher in green, states with coverage from 90 to 94% in red, and states with coverage below 90% in blue. We can see that most states have a vaccination rate of 90% or higher, with only 6 states reporting a vaccination rate below 90%. This map displays MMR coverage for 2019. Note that several states that met the threshold for herd immunity in 2009 are now in the 90 to 94% range, but that fewer states show coverage below 90% or fail to report a vaccination rate at all. Next, we observe the coverage map for 2023. Note that 14 states are now below the 90% mark, while even fewer reach the 95% threshold. This is a marked difference from the 2019 map, especially taking into account that this drop in coverage took place over only 4 years. And as we noted earlier, this drop corresponds with the beginning of the COVID-19 pandemic. In 2023, the states with the lowest vaccination rates were Idaho, Alaska, Wisconsin, Minnesota, and Florida. These states also exhibited the sharpest decline in MMR coverage after the pandemic started, with the exception of Alaska. And while COVID-19 is still present, it is no longer considered a public health emergency of international concern, and patients with COVID-19 are no longer being prioritized over those seeking routine primary care. So why haven't vaccination rates recovered yet? There are multiple factors that may have contributed to a lower vaccination rate during the pandemic. One of them is a lack of access to primary care, caused by physician shortages. Over 145,000 healthcare workers left the industry between 2021 and 2022, and nearly half of these were doctors. Some other factors include poverty and familial instability. Between 2019 and 2023, the number of residents living under the poverty line increased by about 2.8 million. Furthermore, about 1.7 million Americans are considered missing from the workforce. And while this does account for the deaths of working-age people, it also accounts for those who are disabled and unable to work after contracting COVID-19, as well as those out of work long-term due to widespread layoffs and business closures. Both of these groups are more likely to be uninsured than able-bodied workers, and thus less likely to have access to primary care for themselves and any dependents, including children. In addition, over 217,000 children have lost a caregiver due to COVID-19, which could also lead to difficulty accessing primary care and standard childhood vaccinations due to decreased household income or frequent moves within the foster care system.
While measles is relatively under control in the United States, measles is still a significant threat to the rest of the world. In 2023, 10.3 million people contracted measles, so we decided to take a closer look at regions where measles is more common. We took 170 months of measles counts in Africa from 2009 to 2023 and fitted 2 models. ETS, which smooths historically seasonality into a baseline, and autoerema, which reacts more to recent bumps. The plot shows observed cases in black, then a 12 months ETS forecast in blue, and an ARIMA forecast in red. ETS stays nearly flat, leaning on seasonality, while ARIMA dips with late 2023 lows, then creeps upward, carrying wider uncertainty. In short, ETS gives a conservative seasonal outlook, while ARIMA follows recent ups and downs more closely. Here, we explore how U.S. MMR coverage in measles incidence move year to year. The cross-correlation plot shows the strongest link at lag 0. Coverage and cases in the same year correlate around plus 0.4, while lag 1 bar weakens to plus 0.32 and is not statistically significant. Below are Mann-Kendall test on 2009 to 2023 vaccination rates confirm a steady decline in coverage. In contrast, case rates per 100,000 show no clear monotonic trend. In other words, coverage has fallen steadily, but cases have hopped around without a consistent direction. This slide compares annual measles case counts and growth for the US, Europe, and the world from 2009 to 2023. In absolute terms, the top right panel, global counts in green surge around 2013 and 2018 with hundreds of thousands of cases, while Europe in red and the US in blue stay in the low tens of thousands. In relative terms, the bottom panel here, Europe and the US sometimes spike 200 to 300% when a small baseline doubles or triples, whereas global growth never exceeds about 150% because, of course, the denominator is so large. So even through global outbreaks drive the biggest raw numbers, the sharpest percentage jumps happen in the Europe and the US. We merged annual US measles cases per 100,000 using CDC figures and school-age population with national MMR coverage, the mean of all states, for 2009 through 2023. The scatter shows that years with slightly lower coverage correspond to higher case rates, where Pearson R equals negative 0.4 with a p-value of 0.035. This means a 1% drop in coverage translates to a noticeable rise in cases that same year. In short, small coverage losses matter. They quickly show up as more measles per 100,000 children. To wrap up, 3 key points. First, US MMR coverage dipped after 2020 and hasn't fully recovered. Second, while US and European case counts stay low compared to global trends, their year-over-year jumps can actually exceed global percentage surges because they start from such small baselines. However, global outbreaks still drive risk in the US and Europe. Third, we see a significant inverse link between coverage and cases. So even minor coverage declines lead to more measles. From a public health view, any state dropping below 90% coverage faces localized outbreak risk, and herd immunity requires at least 95%. We recommend focusing outreach on states that have lost 5 points of coverage from 2019 to 2023 and tracking those trends yearly. Our next step is to drill into county level data, where available, to pinpoint sub-state pockets of undercoverage and investigate factors like provider shortages or exemption rules that may explain persistent declines. Thank you everybody that was here for this presentation. My name is Harrison. My colleague is Shonushka. We went to school together. We now work together at RSC Statistical Consulting. If you'd like to check out our website, it's rscstats.ai. And if you want to contact us about this presentation, ask further questions, get to know us, or hear more about our business, please contact us at info@rscstats.ai. Thank you.
So we have, as always, we have no time. Um, Peter Higgins, it says you have your hand raised. Do you have a quick question? Or is that just Zoom being Zoom?
Think that was for the congratulatory message in the chat. I didn't see an actual
Okay.
question in the Q&A.
Excellent. Okay. So I just wanted to say I was one of the people who had the privilege of reviewing your work, and it was beautiful and thoughtful, and thank you. I'm curious to know, do you think that you actually have bandwidth to take this to the next level? And are you, do you hope or do you think that you can actually go in and start looking at the minutia, what's going on within the states?
I definitely think so. One thing we considered earlier was we divided the country up into U.S. Census subregions to see
Mhm.
how things were differing from region to region. And another thing we like to do is for the on the international level, compare between countries that have socialized healthcare and those who don't. So those would be the next steps for us.
Excellent. Again, we're out of time, but I wanted to say thank you. It was absolutely beautiful work. So I look forward to seeing more from you and your team in future years. Thank you.
Thank you very
That
much.
means a lot. Thank you.
Okay, and for everybody else, hop on over to the next. We start in a minute, I think. Oh, the pace.
All right, then we'll be leaving too because we'd like to see the next runner as well.
Agreed. See you soon.